C1 and C2, little click. We're in the wrong spot. They're called subluxated. Dr. Haley Parachka here at Team Healthcare Clinic, and we're getting Lucas adjusted today. Coming in with some ear pain, so we're just gonna do a full body adjustment and work on his ears. So you can go ahead and lay on your back for me. Have you been doing any swimming recently, Lucas?
Yeah.
Yeah. You feel that spot kind of right in here, is that it? Okay, I'm going to use the, you're okay with the activator, the clicker one?
Yeah.
Great. Okay. And little click. I'll go on this side. Right up there at the top. Has one ear been bugging you more than the other?
Mm-mm.
About the same?
Mm-hmm.
Yeah. C1 and C2, little click. We're in the wrong spot. They're called subluxated. And those nerves communicate to your ears, so they can make it harder for your ear to drain the yucky stuff out after being in the pool and stuff. Okay, great. Stay here for just a minute. Is this painful as I do, or okay?
Okay.
A little ear tug. Okay. Now, you okay if I take your glasses for you?
Mm-hmm.
Okay, you can go ahead and turn to your stomach. And then I'm going to do some immune boosting points along his middle back too, just to help boost immune system too. Yes. So Lucas, if you feel me kind of clicking away here in a second, that's why. That kind of help boost up the immune system with anything that your body's been fighting recently. You're feeling normal though today. It was just a few days ago you weren't feeling the greatest.
Yeah.
Just the ears bugging you?
Mm-hmm.
Okay. Okay, and then breathe in, hold your breath for me. And then breathe out. And then kind of like, you know, when you're breathing really fast after you ran, it's like panting, like,
Yeah.
do that for me. Keep going, keep going, keep going. And you can relax. It just stimulates that nervous system a little bit more to say, hey, wake up if there's anything you're fighting. Comfortable?
Mm-hmm.
Okay, good. Now we're going to check your legs and your hips. So I'm going to have you go ahead and kick up this right leg for me, high as you can. Relax it back down and do the other side. Okay, a little lower here. All right, kick up that right leg for me again, and the left one. Good. That looked pretty good. Just want to double check it. Sorry. Yeah, there we go. Try lifting your right leg again. and left one. Good. That was pretty good, but I'm going to cross this leg over. And you can untuck that leg, lift up that right one again, and the left one again. Good, that was better. Awesome. Now, come on up for me. I'm going to have you sit facing the door. Just going to look inside your ears next. Well, the good part is it's not red or anything, but I do see some fluid in there, which makes sense. This one, you said they're about equal?
Mm-hmm. Well, this one's kind of muffled. This one hurts.
That makes sense. This next one looks more irritated. So the muffled sound, that makes sense to me. You said you have the garlic at home? Okay, I think I would do it if I was you. Are you okay if I do just a little bit of it's a quick down and up on the ear, okay? Good. Good. Now, I think another thing that could be helpful is if we just do a little bit of muscle massage here to just see if we can help drain the ears a little bit more. So we'll do that in the next room. Is that okay for you? Awesome. All right. Anything else I can check for you?
I'm good.
Good. Awesome.